What do your sinuses do? I'm Dr. Mothan Kandula with Advent. Today talking about sinuses, what they are, what they do, why they exist, and why they sometimes cause some trouble. Sinuses are air-filled pockets within your skull. They lighten the skull because they're filled with air instead of bone, but they're also connected into your nose, and they really work with your nose and work with your entire breathing system to maintain health. So sinuses exist up in your forehead, in your cheeks, between your eyes. That's where they live. So there's really 8 set of sinuses, 4 on each side, for those who like to count at home. Each of those sinuses has an opening into the nose, and they're meant to work in combination with the nose itself. So nose and sinuses working together means you've got a healthy airway, healthy immune system. Now the problem or problems can sometimes arise if somebody's sinuses, if the openings are too small, then that doesn't let the mucus out, and that creates inflammation that's sort of trapped behind the scenes. So if you think about a drain that's plugged up, that can cause a sinus problem. So we call that sinusitis when somebody has inflammation within the sinuses. That can be something that happens all of a sudden, and that's an acute sinus infection. An active sinus infection is another name for that. Or it's something that can happen ongoing, and that's more of a chronic sinus infection. So if sinuses are working normally and healthily, then that lining of mucus combined with the lining of mucus in the nose allows your body to kind of constantly keep both filtering out what's out there in the world and sometimes fighting against it. So your sinuses and your nose are really the first part of your immune system and your defense system against outward enemies. That's why those areas exist. Again, when they cause trouble is usually when there's an anatomy issue, when something's blocked up, or there's an inflammation issue, which is where that lining gets a little bit irritated. And a lot of folks have both of those issues that are happening at the same time. So you can have blocked up sinuses, or blocked up anatomy and inflamed lining, or you can have a blocked up anatomy that causes that inflamed lining because things are getting backed up behind the scenes. So really, sinuses are, when they're working properly, your friends. They help you. They're part of your body's both breathing and defense mechanism. When they're not working, they can make folks feel miserable. Now the good news is nowadays, if somebody does have sinus issues, there are usually multiple ways to go about treating those issues. Most of the time, if somebody, for instance, has blocked up sinuses, we can typically these days do an office procedure in a few minutes to get those sinus areas open properly, get things drained properly, which is pretty remarkable. And so a lot of folks that had suffered through their situation because they didn't feel like it's worth going to extreme measures can now do something active, simple, in the office to get sort of back to that life that you want to have instead of dealing with these sinus issues. So long story short, if your sinuses are working properly, that's a good thing. If they're not working properly, the first step is understanding, well, what are they, what might be going on, and then sort of seeking out some of those answers and some of the solutions ideally, and getting on with things. So sinuses should be your friends. If they're not your friends, and unfortunately they're your enemy, there are many things that can be done about those, and worth seeking out.